Now I'm going to put the same question to each of you, and for your response, what are your organisations doing to contribute to a greener NHS? It's a big question, but let me first of all start with you, Pinder.
Good afternoon, and thank you, Victoria. Sustainability is really at the heart of what Novo Nordisk does, and we call it our triple bottom line. And what that does is ensure that everything that we do, the actions that we put in place, are one, socially, secondly, environmentally, and thirdly, financially responsible. And what that's resulted in is in a bold ambition to have zero environmental impact. So the first thing that we urgently focused on was reducing the environmental impact of our manufacturing at our manufacturing sites. And so at the beginning of 22, last year, we achieved our target of running all our global production facilities exclusively on non-fossil fuel, renewable energies. So we've reduced our carbon footprint in our manufacturing facilities by 57%, nearly 60% compared to the previous year. And I think we're the first pharmaceutical company in the RE100 group to actually achieve this. We're also focusing on waste, and in 2020, 93% of the waste coming from our production sites was recycled or converted to biogas or incinerated in waste to energy plants. And actually, one of our leading production facilities in Denmark is part of the world's first circular production cluster, where biomass is actually collected from production and is directly used as a substrate for producing biogas. And it doesn't just stop with CO2 emissions. We also believe we should be focusing on preserving and conserving water. So 4 of our production facilities are in areas subject to sort of a lot of seasonal variability. So we're continually focusing on reducing water consumption, and we managed to reduce consumption last year by 15% in 2020, but clearly more for us to do. Whilst that's sort of things that we've achieved on the manufacturing site, we also have offices and facilities, globally across the world, and we've got an ambition there to reduce our emissions and targets by 2030 to be actually zero emissions across all our global operations. And so, and we'll do that through reducing travel, making sure all our fleet are electric vehicles, and looking at energy consumption in our offices as well. But it's not going to stop there. And in addition to that, we're working with all our key suppliers, and we're working with around 60,000 direct suppliers globally, and looking at how they can transfer to 100% renewable power by 2030. So that it's not just us, but the people that we work with who supply us. So what does that mean for the NHS? It means that when you use Novo Nordisk products, that you can be satisfied that we're producing those to the highest environmental standards, and that the impact of our products on CO2 levels is approaching net zero. So kind of finally, when the NHS sets its motion of a greener agenda to reach net zero by 2045, you can be kind of reassured that Novo Nordisk will be matching and probably exceeding the ask of suppliers within the NHS.
Well, that's impressive, an impressive start, actually. Come to Tom Delahoyde.
Yeah, thanks, Victoria. Good afternoon, everybody. At Chiesi, we are a family-owned pharmaceutical and healthcare operation. We are absolutely committed to increasingly operating our business in a way that does ensure long-term sustainability by minimizing the impact of our products and our operations. We've set ourselves some very clear deliverables and milestones. We intend, and our objective is to become carbon neutral by 2035, which very much ties in with the NHS objectives. And we'll achieve that in a couple of steps. By 2030, we intend to cut the greenhouse gases on the direct emissions, so scope 1. We also intend to reduce the indirect greenhouse gas emissions in scope 2. So that's the emissions which we gain from purchases of electricity and heat, for example. We will reduce those emissions by 50% versus the emissions we had in 2019. So it's a big objective, but we are very confident we can achieve that. But at Chiesi, we intend to go a step further. And by 2030, we have set ourselves the objective of reducing greenhouse gas emissions per unit of our inhalers, and we are one of the market-leading respiratory companies. So reducing the emissions per unit of inhalers by 80%. And then moving on to 2035, we'll reduce all scope 3 greenhouse gas effects across all of our solid products by 90%. And the big innovation that we'll bring to help us achieve that is we are working, and we're absolutely committed, we put a big investment into a low carbon inhaler, thinking of maintaining patient choice. You know, when we do launch this, we hope to bring this to the market by 2025. It'll have a very low carbon propellant, and from the work we've done, it'll reduce the greenhouse emissions from current pressure meterized dose inhalers by 90%. So we're helping the environment, but fundamentally, we're putting patients at the center of everything we're doing.
Thank you, Tom. Can I ask you now, Anna Murphy, to tell me what you are doing?
Okay, thank you for Victoria, and good afternoon, everyone. So I'm a healthcare professional, so I'm coming very much from the fact that the environment, the pharmaceutical industry, the patient and the healthcare professional behaviours are all very much interlinked in how we can achieve this net zero within the NHS. And you mentioned, Victoria, in your introduction about the efficient use of medicines, and I think that's extremely key for how we achieve this within the NHS. So, you know, we need to adopt very much a patient-centred approach to prescribing medicines to make sure that care is individualised for our patients. Not only that we do sort of guideline-based prescribing, so we're making sure that patients get the right medicines at the right time and are given to the right patient, but we actually support our patients to actually take those medicines so they actually adhere to them, and then we get the best outcomes of those medicines for the patients. And that, of course, has a knock-on effect that actually if you can improve health outcomes, that will reduce hospital admissions, reduce driving to go and see your GP practice, and hopefully reduce perhaps the number of medicines that patients have to take, because of course, as health gets worse, often the number of medicines actually escalates and increases. And we do have a situation where many of our patients end up on so many different medicines. We call it polypharmacy, you know, and I think the average patient with COPD, which is a chronic obstructive pulmonary disease, I think a patient is on about 13 different medicines. And it's important for us as healthcare professionals to make sure that is right for our patients, that patients are included in those decisions around those prescribing, and where possible, de-prescribe some of these medicines for our patients. But it's also not just about our patients, it's also making sure that we are responsible in how we manage the medicines. So how do we order medicines? How do patients order their medicines? So we don't sort of stockpile, we don't hoard medicines. And of course, you know, Pinder, you mentioned medicine waste. And of course, there is so much medicine waste within the NHS. I think it's reported to be about £300 million is wasted on medicines each year. And about probably 150 million of that could actually be preventable if we have perhaps better systems in how we order, and a bit more responsibility from us all really within the supply chain, and also when it comes to patients using their medicines. And I think the final point I want to make sure is that we are all sort of competent in terms of a workforce in how we achieve these outcomes. So things like inhaler technique and how we use these medicines, making sure that all of us working with patients can guide our patients and teach our patients how to get really the best from their medicines, in particular things like inhalers. And the final point I would say is that it is around the recycling and disposal and how we encourage patients to not put our inhalers in the black bins, make sure that medicines are returned back to the community pharmacist is what we really want to encourage, or indeed take on recycling where possible within the life cycle of that medicine. And that's something we are looking at very closely, more locally where I work at the moment, and I'm working with Chiesi on a project which is called the Leicestershire Take Air project, which is action for inhaler recycling. And that's where we're encouraging our patients to recycle inhalers by using a postal scheme to send inhalers back for removing them from the sort of the black bin disposal where many of our patients are going to at the moment, and making sure that those inhalers are recycled and disposed of correctly. So that's the main things I'd like to say, Victoria.